Parkinson's disease is a chronic neurodegenerative disorder, and a particular portion of the brain called the substantia nigra is where the changes take place. The reason it's called neurodegeneration is there are a group of cells which secrete a substance called dopamine. They are located in a part of the brain called the substantia nigra. The substantia nigra is connected to another portion of the brain called the corpus striatum, and together they regulate body movements. And a deficiency of dopamine results in abnormal neurotransmitter. Consider it like an electrical circuit where the circuit is broken, and this leads to defects in movements such as tremors, rigidity, slow walking, stooping, etc., called bradykinesis. There are other features as well. Parkinson's disease is generally called idiopathic, by which we mean we don't know the exact cause. However, there are some situations where there is a genetic interaction with environmental abnormalities or stimuli. These include things like pesticides, because they interfere with mitochondrial metabolism, heavy metals like manganese and cobalt, which also interfere with the neuronal metabolism in these areas of the brain. These are less common, but one should think about it. The major symptoms of Parkinson can be easily observed by the caretaker, the relative, or the neurologist who is looking at them. Even as they walk into the room, you'll find they have a short stepping gait, and as they approach the chair, they tend to run fast as if they are running rather than walking. Along with that, they have a face which doesn't have a sharp expression because associated movements of the facial muscles are interrupted. They have what's called mask-like faces. And what is very obvious is they have a tremor which is resting, and this tremor is a repetitive movement which is called like pill rolling, and they cannot stop the tremor. And associated with the tremor, sometimes when you ask them to move their hands, they are rigid. It is like bending a lead pipe rather than bending a flexible paper straw. That's how stiff they are. Because of the stiffness, they have rigidity, they can't walk, they tend to fall. So that's a very important feature. Besides that, they can have abnormalities on the heart. Their heart rate can go fast or slow. They sometimes have difficulty in breathing. They collect secretions in the lung because their breathing movements are not fully synchronized between the chest wall and the diaphragm, and therefore they are prone to get secretions. They also have salivation or drooling because of pharyngeal muscles, the muscles around the mouth which masticate the food and send it down to the food pipe called esophagus. That coordination is lacking, so there's a backup of fluid, which is why they get salivation. In addition to that, they can have other features such as, for example, slow movements called bradykinesia. Anything they do, it's very slow. And the speech gets monotonous, they don't have the variation. The handwriting gets small, it's called micrographia because they don't coordinate it. So these are some of the other features of Parkinson's disease. Sleep is one that's considerably altered. All of us have cycles of sleep. We have what's called a rapid eye movement, where brain is active, but the muscles of the body are shut off. So that's the dreaming cycle. We don't enact our dreams. But in Parkinson's disease, they dream and their muscles are not shut off. With the result, they can fling their arms, they can get out of bed, they can even hurt somebody lying by their side. So that is a dissociation between the REM sleep and automatic movements. Because the REM sleep is affected, they don't get deep sleep. With the result, they wake up in the morning feeling tired and weak. So their sleep cycle is altered. Their wakefulness is altered. And then the other automatic areas where they have difficulty is, for example, when they eat, they can easily choke because they cannot regulate the swallowing movements from the breathing movements. That's an one of the dangers as the disease gets advanced. The other ones we already talked about is constipation, but the bladder should be brought into the same focus because contraction of the bladder is initiated in the brain, but its regulation is automatic. And when the bladder contracts, the valves should release so the urine flow is normal. This control between contraction of the bladder and the relaxation of the sphincters or the valves is discoordinated, so they may have retention of urine or they may have overflow of urine, and this is called incontinence, which is a major involuntary abnormality. Psychological is important because, as I told you, dopamine is important for emotional activity of the brain, and when there is imbalance, they have nightmares, they have impairment in their emotions, they can laugh suddenly and they can cry because, again, the regulation, the activation or the blockage or inhibition, that regulation is abnormal. Depression, anxiety comes partly because they are aware of their physical limitations. They want to control it. Inability to take charge of their own activity gives rise to anxiety, and anxiety leads to depression, and these act as a vicious cycle. In the same way, stress causes imbalance of the neural hormones like cortisol, epinephrine, norepinephrine, and that can also contribute to anxiety, depression, loss of sleep, state of wakefulness. So the treatment plan for somebody comes with establishing a diagnosis to make sure it is idiopathic Parkinson's disease. Once that has been made by examination and the judicious use of brain scan, the principle is one, replace dopamine when you can, that is with L-dopa, carbidopa, enhance the action of dopamine on its receptors where pramipexole comes in, or you enhance the longevity of dopamine in the brain by preventing its degradation in the periphery by entacapone or in the brain compartment by siligene. With these modalities, you preserve and enhance the levels of dopamine in the brain. That's step one. The other parts in treatment will include promoting diurnal circadian rhythm, regulation of when they wake up, when they sleep, when they eat. If you orderly management of that helps in the body to synchronize the other hormones of the brain made in the pineal body, melatonin, etc. Exercise, physical mobility is a very important component, not only to prevent deterioration but also educate those muscles by the virtue of the remaining neurons being facilitated. Other important areas which people have talked about go beyond medication, beyond diet, beyond exercise, is surgical approach. In the past, they used to destroy some of the areas of the brain which overact by what's called stereotactic surgery, that is mapping structures which are overactive and destroying them with the electrical currents or laser beams. Now, a new modality is called a deep brain stimulation, where they put in electrodes and they can either stimulate or inhibit, just like a pacemaker of the heart, where you can turn it on or turn it off. This is being done in many centers. It is still a work in progress. It does have advantage in that the patient can turn it on when the tremors and rigidity is high, and they can turn it off when they feel better. They work with medical regimen. One does not replace the other. Speech therapy is vital because you can train the muscles of speaking, you can train the muscles of respiration, the pharyngeal muscles and the vocal cords. As far as yoga is concerned, I think it's vital because it again encourages coordinated activity of groups of muscles. Tai Chi does this same thing. Dancing is also very good because it promotes coordinated movement. And the nice thing about these is they not only facilitate movements, they also preserve the structure of the muscles. Along with that, you also want to strengthen the remaining muscles, and so judicious use of weights helps along with yoga physical therapy, Tai Chi, dancing, etc. As of now, there is no definitive cure for Parkinson's. However, one can control the disease very well with medications, diet, exercise, activity, and sometimes surgical. The future hope one day is just like you do a bone marrow transplant in patients with blood disease, can you do a stem cell transplant for the brain? This is a dream on which a lot of research is going on. It is potential that you can take these cells, grow them in a culture plate, give them signals, nutrition, so they'll become dopamine producing neurons, and then you can inject it into the patient and they'll go and take residence in the brain and alleviate the symptoms. This is a pipe dream at this stage, but with the way technology is going on, one will not be surprised. That will be a cure for Parkinson's. Even then, it may not be 100% cure, it may be an 80 or 90% cure, because nature is causing progression. Treatments are trying to block it, but there is a limit to which we can fight nature.